প্রিয় দর্শক, স্বাগত জানাচ্ছি আজকের স্বাস্থ্য কথায়। আজকে আমাদের সঙ্গে একজন বিশেষ অতিথি উপস্থিত রয়েছেন। আমাদের সঙ্গে রয়েছেন ডক্টর ভেরাপন কুয়ানসংথাম। তিনি বামরুগ্রাদ স্পাইন ইনস্টিটিউটের ডিরেক্টর। তার সঙ্গে কথা বলবো মেরুদণ্ডজনিত সমস্যা এবং সেই সব সমস্যা উত্তরণে কি কি পদক্ষেপ নেওয়া যায় এবং বামরুগ্রাদ স্পাইন ইনস্টিটিউটে কি কি ধরনের সেবা রয়েছে সেসব নিয়ে। ডক্টর ভেরাপন কুয়ানসংথাম, ভেরি ওয়ার্ম ওয়েলকাম টু ইউ অ্যান্ড থ্যাঙ্কস ফর ভিজিটিং আস।
Thank you.
Welcome.
Pleasure for me to be here as well.
Same here. What is Bumrungrad Spine Institute? Can you tell me more about it?
We talk about Bumrungrad Hospital. Everybody knows that it's a private hospital, right? Every kind of disease for every patient. So when it comes to the spine, we have a lot of patients. Spine mean we have 33 vertebrae from the neck down to the bottom. And when you say spine center, we have many centers in the hospital, but we have only 2 institutes in Bumrungrad Hospital, which is the first one is spine. The second one is the heart institute. So the difference between the institute and the center is the center, you treat the patient. It's only the service to the patient, but the institute, you share the knowledge, which means teaching. Teach the doctors, teach the specialists. I explain later. And then another part is the research and publication. It's more like a medical school. So that's the difference between the institute and the center.
What are the services provided at this center?
The service provided is the spine-related disease. The most common is the degenerative disease, like a slip disc for the younger patient, or the stenosis for the older patient that account for more than 80%. And the rest is the injury to the spine, like the fracture of the spine and the osteoporosis fracture, the infection like tuberculosis or bacterial infection, and the tumor that happen in the spine. And we cover all the specialty for the spine patient. And we have neurosurgeon. I'm a neurosurgeon, orthopedic surgeon, the pain intervention doctor, and the rehabilitation doctor working together like a team to the patient. That's what we provide for the service.
Okay. How are the treatments there, and what about the rate of success of it treatments?
When we talk about the rate of success, mostly we mean the surgery and the intervention. So let me give you some overall pictures about the treatment. So most of the patients come with a back pain, neck pain. 60% of this patient can be treated conservatively by the physiotherapy, by the pain medicine, bed rest. That can be done in the local hospital in any country. So we have more than 50% flying in patient. That means the patient that fail with the conservative treatment, another 40% that need more intensive treatment like radio frequency treatment, epidural steroid injection to the spine. Only around 10% that need surgery. I'm very proud to share with you that we are very strict about indication for surgery or indication to do intervention.
That's great.
Because the most important thing to have the good success rate is a good indication. Okay, we have a committee to review every case every day, that any doctor make decision for any patient. So it's not an individual decision from any one doctor. It's a group opinion. So that's why we maintain the overall success rate nearly 95%, and with a very low complication. This is very important. We even benchmark ourselves to the U.S. famous hospital. I don't want to mention the name. The success rate and also the complication. The most dangerous thing that the patient afraid is the infection to the spine after surgery. We have 0.33% infection for the past 5 years, comparing to 1.6 or even 2.1 in many famous hospitals.
Okay. What is the latest technology used for spine surgery?
When we talk about the latest technology, that means the technology that less than 10 years, but we have been doing the endoscopic surgery for the past 13 years that I joined the Bumrungrad Hospital in 2009. So this is the latest technique until now, but we expand the indication to treat. We start with a slip disc. We use endoscope 8 millimeters, and now we can expand to the neck, and we expand to the stenosis, more difficult cases for 70, 80, even 90 years old patient that cannot walk long, and you have to sit and walk all the time like that. So this is our leading procedure and latest technology, the endoscopic surgery.
What are the ways we can keep our spine in good condition?
That's a good question. Okay, prevention is always better than surgery.
Yeah.
So number one is the spine. When you wake up, you use your spine.
And when we sit?
Sitting is the worst position for the lower back. Even worse than when you stand or walk. Okay, so number one is you have to control your weight, your own weight, and you don't want to increase your weight by putting, like for example, backpack, carry heavy thing that put more load to the spine. Okay, number two is you have to increase your strength. You cannot make your spine bigger, but you can make the muscle around the spine bigger and stronger. So good regular core exercise will provide more stability to the spine and prevent the damage to the spine. This is two important things.
Doctor, you talked about the latest technology you used for spine surgery. How did it help with the outcome?
When you introduce the new technology, you have to maintain the same success rate as a conventional technology, at least same, not below. Okay. Endoscopic comparing to microscope or open surgery, we provide the same success rate with the less injury to the muscle around the spine. Because if we do surgery with the conventional way, we look from outside, even with the microscope. So the bigger the patient, the bigger you have to cut in order to see enough. But with the endoscope, we look from inside. We have the lens at the tip of the endoscope. So it doesn't matter how big the patient is. We make 8 millimeters hole, doing the same thing. So we have a comparable result with the less pain and less recovery. And for the international patient, they love it because they can predict the stay. Okay, we do under general anesthesia, and then 2 hours in the recovery room and send them back to the room. They walk immediately, and they have to stay in the hospital 12 hours, or some patient they want to stay at night. So maximum is 24 hours. So you can plan the stay before and after surgery within 1 week, and then you fly back. That's the great benefit of the latest technology.
That's really great to know. Could you please explain the differences of conventional surgery and minimally invasive surgery?
Yeah, the concept is you want to fix the spine. Something is pinching on the nerve. You just want to free it. And the part that pinch on the nerve, we're talking about less than 1 centimeters. But you have to cut big in order to reach the deepest part, because the spine is at the core of your body, right? So that's why with the minimally invasive, you put the endoscope through the muscle. But if you do conventional, you have to cut the skin, cut the muscle from the bone in order to reach to the spine. And that creates the bleeding, the pain, that we need more painkiller, like need more morphine. And the side effect from the painkiller, the blood loss, especially with the elderly patient, that will affect the heart. Okay, so we have the patient that undergo surgery with us, 70, 80, even 90 years old with 1 day stay in the hospital because the blood loss is minimum. That's a big advantage.
Then what are the ways we can keep our spine in a good condition?
Like I mentioned before, it's a regular, good, adequate exercise to the muscle around the spine, lower back and the neck, and avoid the damage to the spine, like some activity, like people like to do kickboxing a lot. They have to jump, and they have a lot of impact, and the extreme sport, water sport with a lot of banging on the water, that's bad for your spine. Yeah.
What are the common spine problem or injury?
The slip disc is the most common. It can happen from the teenager to from 18 to 80 years old.
When should a person having back pain should go for a surgery?
We don't do surgery to cure the back pain alone. The indication for surgery is when the pathology, the disc or the bone pinch on the nerve, you have leg pain, numbness, weakness, and fail with the conservative treatment. That's an indication for surgery. If the patient come to me with the back pain alone, very rare that we do surgery. Okay, we do surgery on the case that with a disability, some weakness, foot drop, or the pain that doesn't respond to the conservative treatment, but mainly the leg pain. Or for the neck, mainly the arm pain, arm symptom.
Okay, we'll be back within a short break.
Thank you.
প্রিয় দর্শক, ছোট্ট একটি বিরতি নিচ্ছি। বিরতির পর আবারও আসছি আলোচনায়, সঙ্গেই থাকুন। প্রিয় দর্শক, আবারও স্বাগত জানাচ্ছি স্বাস্থ্য কথায়। আমাদের সঙ্গে উপস্থিত রয়েছেন একজন বিশেষ অতিথি, ডক্টর ভেরাপন কুয়ানসংথাম। তিনি ডিরেক্টর, বামরুংগ্রাদ স্পাইন ইনস্টিটিউটের। আমরা কথা বলছিলাম মেরুদণ্ডের নানা সমস্যা নিয়ে। আবারও ফিরছি আলোচনায়। ডক্টর, how long have you been working at Bumrungrad Spine Institute?
I joined Bumrungrad in 2009, 13 years ago. And my mission at that time is to set up the Spine Institute. So I was the one who set up the Spine Institute. It took me 1.5 years. So I set up the Spine Institute in 2011.
11.
Yes.
Okay. From a medical perspective, how do you find all the facilities there?
As a private hospital, I would say that I very much appreciate Bumrungrad Hospital administration because, you know, many latest technology comes with the price. And many times that in terms of investment, you don't get profit from buying high-tech instrument, but it's good to the patient. And the way they charge is almost similar to the public hospital. And that's why we have a lot of latest and good technology and on demand. So when we want to buy something, it has to be from the doctor, from the surgeon side, rather than the hospital. Normally, most private hospital, they reject, oh, that's too expensive, that's not going to make money, but that's not the case for Bumrungrad Hospital. That's what I appreciate because I'm coming from the medical school.
Well, how many surgery cases have you done and overall for Spine Institute?
Let's say for the spine, because I graduated as a neurosurgeon almost 30 years ago, okay, and worked for the medical school, and then I joined Bumrungrad 13 years. I have, let's say, the overall center from 2011, we have done, all the team have done nearly 6,000 surgeries and more than 6,000 intervention case under local surgery, under general. My case is normally around 50% of that.
Okay.
Yeah. That is a good question. When the patient want confidence from their doctors, from their surgeon, they ask how many cases have you done, something like that.
And why choose the Spine Institute in Bumrungrad? Why someone or why a patient will choose?
I think after we have been talking for...
people will learn about
it. So you know the reason, but if you ask me, I would say we are not only the expertise with a lot of experience, but we are also the leader of the minimally invasive, especially the endoscopic procedure, because not only we treat the patient, but we share our knowledge. The one who invent the endoscopic technique and procedure is the German Professor Sebastian Rutten, and we have been working together even before I joined Bumrungrad. So we are together, we're teaching the world. Twice a year in Germany, once a year at Bumrungrad. We collaborate every year, twice a year. I have to help him in Germany teaching European and American doctor. At Bumrungrad, he comes and help me teaching the doctor in the Asia Pacific, the Japanese, the Chinese, the Korean, Singapore, and they come to learn the technique from us. For the past 13 years, we have been teaching more than 2,000 spine surgeons over the world. That is my pride as well, and that I think that says something that we are the master, and we control ourselves about the complication. And any doctor with any procedure, and if you make too much complication, we have proctoring system in the hospital control. That is another thing to ensure the safety, the maximum safety to the patient.
Okay, doctor, how does it cost if someone have to go through the back surgery, spine surgery?
Right now, if you talk about the most common is the endoscopic surgery. We have the package, and that means it doesn't matter difficult or easy. This will be around that price. Is quite precise, and it starts from in US dollars maybe $10,000 US dollars, $10,000 US dollars with one night stay in the hospital.
Okay. As a doctor, what message would you leave for the people who are suffering back pain?
I think for the people who suffer the back pain already, if it doesn't go away by any means, the conservative treatment in 3 months, you need to seek the opinion from the specialist, from the spine doctor. And if you seek opinion and the opinion come out that you need surgery, you need second opinion, not one opinion. And for us, it's a group opinion. So we call ourselves, let us be your last opinion, which is a group opinion. And when it comes to surgery, it doesn't mean that you have the same procedure, same name. You're going to have the same result. It depends on the hands of the surgeon. So you need to find the right surgeon with good enough technique, instrument, and enough experience, number of cases.
Doctor, how a Bangladeshi patient having spine issues can contact you at Bumrungrad?
Well, we have 3 different offices in Dhaka from 3 different partners that you can contact. And also from the website, if you type Bumrungrad Spine Institute, and then you can make online appointment. Or even telemedicine, you can request for telemedicine and have a prior consultation before deciding and coming to Bumrungrad. That's another way.
Thank you very much, Doctor. I think people will be very benefited from your valuable advice, and thanks for visiting us. Thanks for your valuable time. Wish you all success.
Thank you very much.
দর্শক, এই ছিল আজকের স্বাস্থ্য কথায়। আমাদের পরবর্তী আয়োজনে আমাদের সঙ্গেই থাকবেন। ধন্যবাদ এতক্ষণ সাথে থাকার জন্য।